Hey, it's Dr. Jeremy. In this excerpt, we're talking about something most people never think about: wisdom tooth extraction. You've probably been told it's just a simple dental procedure, right? But what if that one procedure was draining qi from your fire channels and throwing your entire autonomic nervous system off balance? Stick around, because I'm going to break down how this connects to your adrenals, your heart, and even your body's inflammation response, and what you can do about it.
Wisdom tooth extraction, I think I hinted at this, or it may have been on the pre-event Zoom, I don't recall. Wisdom tooth extraction, draining qi from fire channels. Another little thing, we said #1 killer in the United States is heart disease. Well, doesn't the heart channel flow through there? Don't the pathogens from the mouth love heart and heart valves? Don't these pathogens go into the blood directly from the mouth? Central circulation, so that when I looked under a microscope and I see pathogens, many of those pathogens come from the mouth in our current society. And like I said, maybe back in 1920 it wasn't like this. Maybe. Back to what I was saying, wisdom tooth extracted drains qi from triple energizer PC, offsetting the autonomic nervous system, putting an on signal on this adrenal nerve. T2 through L1 is now giving adrenal go, 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 pushing the adrenals. After a couple years, the adrenal glands can't keep up with production of neurotransmitters, so they become deficient. But the on signal stays on until you treat the wisdom tooth, basically, which is totally out of the scope of this class, right? I teach that in September. But you can turn this adrenal off. We call this the beach treatment. And what frequency would be awesome? If it was important, choosing frequencies, which it isn't, what frequency would I use to turn off a sympathetic nerve? 73, right? To 80. 20 minutes, right? To turn off the sympathetic going to the adrenal glands. We call this the beach treatment because the patient usually feels like they're laying on a beach.
They love it.
They love it. It's really amazing. The adrenal glands are more directly connected to the spinal nerve than the other organs. The other organs are spinal nerve is the preganglionic and it junctions at a different nerve and then goes into the organ. Adrenal gland is directly connected to the original output of the adrenal. And adrenals are super important, and adrenals and thyroid are best friends. A problem in the thyroid can make an adrenal issue, and an adrenal problem can make a thyroid issue. And of course, an adrenal issue can create problems in all the other organs, and a thyroid issue can create problems in all the other organs because of the power of them and the functions that they have. What are you looking at here? This is the left vagus nerve, stomach 9, extends down to this celiac plexus, which in blue here, which goes to the adrenal glands and also innervates the spleen organ, which is why we can get these glands, once giving it enough ichi, to stop producing inflammatory molecules such as tumor necrosis factor alpha, interleukin 1, interleukin 6. Sounds all cool, right? They're just anti-inflammatory, they're just inflammatory molecules that we can turn off. They're in overproduction because the terrain of the adrenals and the spleen got bad. The terrain of the immune system got bad, the blood. So correct it and rectify it. Now, what are you looking at here? This sheath here in front of the anterior aspect of the spine, that is the dew channel, a cabling system of probably the most electrically conductive tissue. We said the second most is the epineural covering. First is the fascia, and this is a lot of fascial-like material, a cable in the anterior aspect of the spine.
ALL.
What's that?
ALL.
ALL. There's the adrenal glands. They're so cool and fascinating. I think they are anyway. Different parts make different hormones, sex hormones, adrenaline, so on and so forth. Now we're into digestive and genitourinary gallbladder disease, meaning gallbladder organ levels T10 and T11. So another diagnostic tip. Patient comes in, I had my gallbladder removed 20 years ago. Well, the gallbladder nerve is deficient. There's diagnosis, under 10 seconds, super accurate and fast. Gallbladder removed, T10, T11 deficient. Now the tough part happens. How do you treat a T10 through T11 deficiency? Oof. Difficult class. Sorry, y'all, I'm making you think on a Sunday. T10, T11, right? Most organ disease come from sympathetic dominance, which makes it super simple for us because most pain and inflammation comes from sympathetic dominance as well. So the treatment's the same. You treat for 20 minutes, turn off that sympathetic dominance, and feed Qi on that neural level into the gallbladder organ. Now, there's signs. When a patient has a neural level T10 through T11, what other signs might the patient have? Well, it's everywhere, the T10 through T11. Might they have belly pain on the T10 dermatome? Might they have blemishes on the T10, T11 dermatome? Might they have hip pain, which is generally related to the gallbladder organ? Why is hip pain related to the gallbladder organ? Well, what channel feeds the gallbladder organ? But remember, channels don't go everywhere. We have spinal nerves as well. So the gallbladder organ is fed Qi from the sympathetic spinal nerves, but it's also fed Qi from the gallbladder channel. So does that mean that the neural level of T10, T11 are actually connected electrically to the gallbladder channel?
Before we keep going, make sure to subscribe below or join our email list. That way you won't miss the next deep dive. We release new clinical insights and practical protocols every week. So if you're serious about results, this is where you'll want to be. And keep watching. There's a valuable resource waiting for you at the end.
Probably. So that a deficiency in gallbladder channel can drain neural levels, or neural levels can drain channels, or tissues of the gallbladder that are infected can drain the neural level and the channel. That's why step one of our diagnostic process is identify which terrain is deficient in the patient. Accuchannels, neural levels, and tissues. And this weekend's focused on neural levels. Liver. Let's give a liver treatment. We have a patient that would like treatment. Come on up. And we'll give you a microphone, and then Jill will get you set for what am I going to do, right? So we're assuming if we could treat any one thing, what would it be?
Aside from my liver?
Yes.
I've been having some upper thoracic shoulder pain.
Okay. Gotcha. Upper thoracic shoulder pain. Anything else?
I can go down the list. I got hip pain, knee pain.
Hip pain, knee pain. Which side, hip or both?
Today it's left.
Left hip, but it alternates?
When I do liquor classes, yes.
Okay. So, and then why do you think your liver's deficient?
Through birth, my mother passed along Hep B to me.
Okay.
Kind of came down the channel, so.
Gotcha. So the terrain of the liver may be off, and Hep B, you have Hep B? Mm-hmm. Hep B is in there, which is an insult to the liver organ. Now, out of everything you listed, I know I'm going to treat liver organ. What's second most important for you today out of everything you listed?
Right shoulder.
Right shoulder? Mm-hmm. Okay. So diagnose the right shoulder, y'all. Can you put the hand on the pain? What neural level is that? You all are looking at me for the answer. I have no clue. I would guess. C6, 7? Yeah, I would guess C7 through T2-ish. And now this goes to show that we can treat organs and pain in inflammatory bracket also, which is what I'm going to do. Thank you. So let's get you comfy on your left side with your back side showing the camera. Thanks, Joe. What am I going to do? Well, we've diagnosed her liver organ and neural level, T9 through T10. We diagnosed her pain and inflammation, neural level deficient is C6-ish through T2-ish, based upon that dermatome chart, right? Yeah. Thank you.
And just pull however you need.
Okay. Let's go up. I learned that from Kiko. Kiko style. Paper tape. That's why I get paid the big bucks. Paper tape. Kiko style, you got a problem? Let's stick a piece of tape on it. That works. We diagnosed T10, what was it, T9, T10 for liver, but error on the side of a vertebrae lower. So maybe T10, T11 or T11, T12, it'll still work. L4, L3, L2, T12, T11, T10. Is that okay? Mm-hmm. Now, I don't want to hurt my brain, so, and this sports bra is in the way. No, you're fine. I want to use this to demo that you could be a sloppy selector because the dew channel flows up. So let's see the highest level, L4, L3, L2. Remember what's one of our magic levels, L2. This is a bracket for liver organ. And this one I'm lumping in the same thing, liver organ. But now I'm accessing L2 as well, 2-needle bracket. Sending electricity to the liver, after 20 minutes, turning the sympathetic signal off at the liver. Okay? Now we need to do a pain and inflammation bracket, or we want to, right? And we said C6, and another magic level is T2. Remember I told you all that? So I'm just putting my fingers on T1. How do I know it's T1? I don't care. It may be C6, it may be C7. Who cares? Just get close. We'll call this C6. And we'll call this T2. The important part is that you stay close to the spine, y'all. Dew channel should be center of the spine, right? I'm going to have Jill hook her up, but what frequencies am I going to use? Oh my God. 4.6 and 73. Now you don't have to do like me, just because I love 73 and 4.6. When you get back to your clinics, choose any 2 frequencies you want. Or if a lower voltage device, your frequencies are already set. One machine's going to be fastest at 513, and the other machine's going to be 1-ish or 2-ish, depending upon what machine you have. So where am I going to place the leads, red or black? Oh my God.
If this made sense and you want to take the next step, we've got a free resource waiting for you, the Beach Treatment for Adrenal Health. It's one of our most popular protocols because it helps calm the system and bring your adrenals back into balance fast. You can get it right now at electroacupunctureinstitute.com/84, totally free.